To address this gap, we have designed Earthranger Health, which extends the Earthranger platform to connect people living and working remote, biodiverse landscapes and their observations of animal health to decision makers in conservation, veterinary medicine and public health. The power of harnessing Earthranger is that it is already being used for protected area management in over 40 countries. We are currently piloting this participatory syndromic system with community rangers in conservation areas of central and southern Kenya in partnership with the Kenyan government. Early results suggest the system is capable of detecting morbidity and mortality in wildlife, and rangers are gaining new knowledge from their training. In our planning grant, we set out to explore the value proposition of this system to pastoral communities who live on the front line of wildlife-borne zoonoses, and to government stakeholders who are responsible for controlling these diseases. We also sought to explore response capacity, particularly how broader participation in the design of disease management plans could promote more effective and sustainable approaches to controlling wildlife disease.
Community data was collected through focus group discussions conducted with community participants from conservation areas where the Earthranger Health tool is being piloted. The community's desire for better management of wildlife-borne zoonosis was evident, with benefits including improved health of all animals, people, and the environment. Opinions on economic benefits were particularly diverse, ranging from direct impacts on their livelihoods through animal health, trade, and reduced burdens on healthcare systems, to more nuanced connections between wildlife health, biodiversity loss, and local economies. The community members showed that they would be good reporters of wildlife-borne zoonosis syndromes. They also demonstrated the ability to identify baseline signs of illness in wildlife, having gained these skills through experience and indigenous knowledge over years of close interactions with wildlife.
Earthranger Health brings in a huge value in wildlife-borne disease control. And if you look at the different stakeholders, people like the communities, talking about public health, the government, the earlier you detect the disease, the better. So that to me is a huge value. You're able to detect that disease before it spreads out, before the spillover.
The intricacies of biodiverse working landscapes present both challenges and opportunities for managing wildlife-borne diseases. Traditional medical and veterinary interventions tend to be reactive and can be less effective for pathogens with complex transmission pathways. Including ecological and social processes that precede outbreaks and broadening participation in management planning could identify leverage points that unlock a wider range of potential interventions. We put this into practice by bringing together diverse stakeholders in Kenya to develop a participatory framework for identifying and prioritising interventions. The group focused on 4 wildlife-borne zoonoses with an environmental stage in their transmission cycle. From this process, we developed a framework that positions leverage points and interventions within the context of relatable, real-world landscapes and complex transmission processes. Strikingly, we found that using this framework, workshop participants identified 73% of all evidence-based interventions in the published literature for our 4 pathogens.
By encouraging co-production of knowledge, ideas, and consensus on how to manage complex disease systems, this approach shows huge potential. It could be applied to enhance action plans for disease prevention and control in a way that is both ecologically and socially informed and beneficiary-oriented.
To reach this point, though, we need to grow our team, specifically with support for young, African data scientists and epidemiologists. Being based on technology that is already being widely implemented and a framework that can be easily adapted, our approach is both cost-effective and scalable.